What's happening, everyone? Today, we've got Dr. Stephen Hammer with us yet again. Steve, how you doing?
I'm doing fine, thank you.
So you recently had a patient, which was me, and I had hurt myself in such a way that my back was all in a lot of pain, and my movement was off. And it stemmed from actually me, because once you get to your late 30s, early 40s, when you sit for a while, you get injured. And so it started at my lower back, and it worked its way up to my shoulder to where I had to keep my shoulder like this the whole time. Otherwise, it was some pretty excruciating pain. Mm-hmm. And so I went to Steve, Dr. Hammer, Steve, whatever you want. But, and I actually got fixed. I was in a lot of pain, got fixed. So I want to kind of like dispel the rumors that people always say about like, once you go to a chiropractor, you're there for life, because I'm obviously not going now. Mm-hmm. So why don't you show us a little tricks of the trade and see how you fix me?
Okay, well, first of all, your comment about once you go to a chiropractor, you got to go for life. The same thing with a dentist, the same thing with a physician. You go once, you got to keep going back. Nothing different here. You're just dealing with what you have to work with, which is usually years and years of neglect, misuse, degeneration, and people think you can get fixed in 2 visits. And no, it's you had a lifetime to get ahead of us and probably take a lifetime to take care of this.
Yeah, the first 2 visits are like you're still getting that pain. Mm-hmm. But you're just trying to work it away. And you're right, because I'm lucky that I just thought I could deal with it for like a month or 2. And then I was like, this seems like it's getting worse and worse. So you finally have to just go in.
Yeah. One thing about pain and degeneration, especially like arthritis, it only goes one way.
Yeah.
It doesn't go the other. Yeah. So if you don't take care of it, there's no turning back. Somebody has to help you. Right.
Yeah, and it's just that's a good point. Like, it won't go away, but you always think because your body heals a cut or your body heals a scrape or whatever that it's going to heal that too.
Yes. I mean, your body can heal a cut or a scrape, but a little bit tougher to heal a gash. Or when you lose a limb, it's a lot tougher. So you kind of got to put it into perspective as to where this is. And this is closer to losing a limb. It's once you get the degeneration, the ligament laxity, it's permanent. The best you can do is try to get it as well as you can and then keep it that well, but it'll never go back to where it was. Well, maybe if you come in when you're 12, maybe yes, because your body can still heal and still fix it. Yeah, but after 30, no.
Man, that's a rough one.
Yeah.
So, but how did you, because for me, my symptom was that my neck, I couldn't I couldn't go back or whatever, and and my shoulder was like popped out. I kept having to pop it back in. Mm-hmm. But that wasn't the initial problem. That was the symptom, like you said. So how do you figure that out?
Well, first of all, when people come in with a symptom, that's usually the end result of a chain reaction. I like to say it's a set of dominoes. They come in with the last domino, finding the first one is the trick. That's what takes the skill. That's what takes all the training. Yeah. So we looked at the shoulder first, see what was going on with that, how bad that was or was not, make sure that it was something we could treat in the office. Mm-hmm. Because if it's not, then we don't want it in the office. We want you to go to somebody that can help. Either physical therapy, acupuncture, a surgeon, if it's bad enough. So we do all the testing to make sure that this is something we can do there. So we looked at that, and then it's, okay, the shoulder's not functioning correctly. What keeps it from functioning correctly? In your case, it was your mid-back. And the area of the mid-back was an area that is compensating usually for something else, which ended up being your low back. It was your low back causing an issue, causing your lower mid-back to compensate for that, causing your mid-back to compensate for that, and then because your mid-back was locked up, and we'll get into this in just a few minutes, it caused the shoulder issue. So I could have worked on your shoulder from now until forever, and we would have become good friends, and I would have become rich. But it wouldn't affect your shoulder, okay?
We're already good friends.
Yeah. Okay, well, let's just work on me being rich then.
So, but how would anybody go about like preventing that? Like, obviously not sitting for a while, but like, should I sit like that or should I sit, like, it seems like it was just, I was maybe hunched over, like Ben Affleck, but it was riding Good Will Hunting. and Matt Damon's in the corner, just like, I don't know, doing push-ups or something. But, like I really noticed that there was like a lot of strength loss and a lot of just atrophy going on there,
Well, first of all, it's been said, and it's conventional wisdom, is that most of the musculoskeletal problems that you come in with, and most people in the office coming in over 30, usually over 40, they acquired years and years and years ago, usually when they were children. You fall out of a tree, no broken bones, no blood squirting out. You're just bruised. You'll be okay. Well, you may have knocked something out, like your pelvis out of place, and because you're young, you can compensate for that. And your body can compensate until you start hitting your mid to late 30s, early 40s. Then all of a sudden, your body goes, "Okay, I can't do this anymore. Let's just go ahead and let them know there's a problem here." And they wake up one morning or bend over, and they go face first into the ground, and they can't move because the back's so spasm. Well, it's taken them, 35 years to get there. So that's usually what we're dealing with. Then there's arthritic degeneration, ligament laxity, and so on. So
when it goes that far, it's going to be permanent then, right?
Well, you have some permanent instability. You may come in with an 80% permanent instability, and we may get it down to 10. But there's always going to be some, because the ligaments will never heal 100% again. I mean, you're over 18. That ship sailed. So people come in. They as a child, they injured their low back, not knowing it, because it didn't create any problems. And mom didn't take him to a chiropractor to have him checked. By the way, something that may take 15 visits to get an adult back to may only take 1 or 2 for a child. They're really resilient. They bounce back real fast. So you started out,
but you never know. But you never know that they're in any kind of that they have a problem though, because there's no real pain.
No, there's not. No, that's why I have several patients that bring their children in just once a year, just to have them checked. And they say, when do I have to come back? And I said, just a little problem next year. That'll be fine. So you don't really know unless somebody who knows what they're looking for can find it for you.
So I must have probably got some kind of injury with the many times I fell skateboarding, and it's just catching up.
Yeah, a problem with skateboarding is there's no soft surfaces. Okay, everything is really, really hard.
Your head?
Yeah, well,
it's got hair.
For all that's worth.
Asphalt's better to fall on than cement.
Yeah, that's true. Asphalt's much better.
Yeah.
Grass is even better than that.
The rolling, though. Yeah. You still have to be able to roll. That's the trick. Yeah.
Well, that's fine, but you always see the videos of where the skateboard goes out from underneath you and you go flat down. Yeah, you knock something out of place. And it's not going to go back in until it starts creating symptoms. By the way, getting back to children and symptoms, children shouldn't be having neck pain, shouldn't be having headaches, shouldn't be having back pain. If they do, then they have a problem that really needs to be addressed. Not just, here's a couple aspirin, we'll be fine tomorrow. Oh, tomorrow, Mom, my back still hurts. Well, and it keeps going on and on and on. Kids don't complain about that kind of stuff unless it really bothers them. And if it does, then Mom's got to get them into a chiropractor to see what's going on, to make sure they haven't got something else going on besides musculoskeletal. And if it is, then fix that. Yeah.
But that seems like it'd be a hard message to get across because...
Oh, it is because it's nothing, like I said, there's no gashes. It's not an ER problem. It's just you don't feel that great. Oh, okay. Yeah. That's just growing pains. By the way, there's no such thing as growing pains. That's a myth.
Well, what is the pain then?
The pain is because you have other things going on, such as a malfunctioning joint or spine, something like that. Remember when you have a vertebrae that misaligns, which is also called subluxation, also called aberrant movement. You always, first of all, pinch a nerve. Secondly, you create muscle spasms because of the pinched nerve. And Third, long term, you'll create arthritic degeneration. So if children are having pain, especially at night, and that's a lot of times when you have it because there's no other stimulation around, nothing else distracting you, it's not growing pains. It's because they've got something misaligned, putting pressure on a nerve, and then that is causing the pain.
Oh, really? Mm-hmm. So with arthritis, if somebody already has like rheumatoid arthritis, then what would you be able to do with them?
Okay, rheumatoid, good question. Rheumatoid arthritis is a disease process. Nothing you can do about that.
Right.
Very little. It's a disease process that eats away at the joints.
Right.
What we deal with is the vast majority of arthritis, which is degenerative arthritis. That's a joint that is not working properly. It starts to degenerate, and then the body starts putting in what's called cheap bone. That's the arthritis.
Oh, is it like the spongy kind, right?
Yeah, it tries to ossify the ligaments around it. Since it can't fix the joint that's degenerating, it's trying to freeze it. And a lot of times by the time it freezes it, then it feels okay. But then, of course, you lost use of that joint.
Mm.
So if you had degenerative arthritis in your finger and it started to ossify, well, it'd feel great once it completely ossified and became a solid mass, but then you couldn't move your finger.
Oh.
So there's a price to pay for that.
Yeah, no, I think I had a guy on the show that had that. I think that was wrong with his hand because I don't think it was rheumatoid arthritis. It seems like also a lot of women get rheumatoid arthritis rather than men.
That I don't know about, but it does seem that way. Yes.
Yeah, it's just because maybe.
Well, female bone structure, muscle mass is not as robust as men because they're not going out and hunting down mastodons. Okay.
We are.
Yeah.
Yeah.
So
every Thursday.
Yeah. And so they don't have to have that. They have to have other attributes such as stamina, which is why you don't see men in aerobics classes, or you don't see that many men on the Stairmaster.
Oh yeah, doing cardio.
Yeah, you get a woman on there, she's going like for 45 minutes an hour and barely breaking a sweat, and a guy gets up there and after 5 minutes he's exhausted.
Yeah, that's true because I've actually just started going to the gym again. And I've noticed that like I'm getting a lot less like aches, like it's the soreness of muscles, of course, but like I can't like stress enough that working yourself, as long as you don't like overdo it or like do this while you're trying to push up and crink your neck, but it's a lot. I feel a lot healthier, like I feel a lot better, and I couldn't go to the gym for a while because of the injury, sure. And then because of Fitness 19 screwed us over. Yeah, shout out to Fitness 19 screwing me over because I canceled that one Fitness 19, and I guess I have to cancel it all the ones I ever went to, even though I had one account and they only charged me once, but they kept charging me. And it's like $19 a month, right? So those are the charges that you don't necessarily look at. You're like, where'd you spend $1,100? You look at that, but the $19 is like, oh, okay. But it ended up being like almost $700 over the course of like a couple of years. And I looked and I called them and they were like, oh yeah, you canceled with this one, but not this one. So then then my wife was like, I felt bad about like, hey, I want to go to the gym again, because that's the sore subject for a while.
Yeah, I bet.
But now, and she's doing yoga too, and it's helped her a lot. And it's just like you have to maintain it. You can't like if you're sitting down and like I work at a computer for my job and I work from home, so I don't actually even go anywhere. And if you just sit for a while and you're sedentary, then your muscles start to atrophy, and it's almost like your bones take that brunt because there's nothing strengthening around them, right?
Yeah, I've given talks on this before about movement. And the human body is meant to move.
Yeah.
And if anybody who doesn't believe that, take a popsicle stick, tape it to your index finger, and in about an hour, your index finger will be so painful you have to rip it off because it's meant to move. Now, trees aren't meant to move, so they're fine just standing still. But if people don't move, the muscles start to degenerate. They just start to lose their tension and atrophy. The bones do the same thing. bone calcification is a direct result of the stress that's put on it. So sitting, like they used to say, what is it? Sitting all day is the new smoking because it may not give you cancer, but it's just about as bad for your body.
Less cool, though.
Mm-hmm.
Wow.
Yeah.
That's too bad.
Yeah, we weren't designed for this lifestyle.
Yeah, I know.
Yeah.
I mean, but you don't really, it's something that you kind of get caught up in and you have to be reminded of.
Yes, and it's easy to, the gym is hard to go to and easy to forget.
Mm-hmm.
It's like beating yourself with a stick. It feels good when you quit. It feels good when you're finally done.
Yeah.
And I can't wait to go tomorrow. Then tomorrow comes, oh, well, I went yesterday.
Yeah, well, actually, the cold plunge helps with the pains as well.
Oh, yeah, contrast therapy?
Yeah.
Oh, that helps immensely. It is horrific. It is getting into...
Just because it's uncomfortable, you mean?
Yeah.
Yeah.
Yeah, because it's uncomfortable. Not bad for you. It just is not very, very much fun.
Right.
That's where you heat your body up, usually with a sauna or in a bathtub, hot bath. And then you go directly from there into an ice bath. And that contrast in therapy really works well on a whole host of conditions, musculoskeletal being one of them. I have a number of patients that do that, and it's seen really good results in their the spinal problems, back problems, especially people who have jobs that are physically demanding. How does
that work? Does it just shock your spine back to like?
It's the best. How do I say? Best definition is that it shocks and resets the system, and that's what that does. Well, if you look at football players, you go into the locker room after a game, you got guys sitting in tubs of ice. Mm-hmm. That just looks like a whole lot of pain to me.
Yeah, and they seem so comfortable in there.
Yeah, they seem like they like it.
But what I've been doing is just like waking up and going in that pool that I have out there.
This time of the year, it'd be better if you woke up, took a hot shower, put on your swimsuit, and then went right from the shower wet into the cold pool.
Well, who said anything about swimsuit?
Okay, well, I'm not going to look. It's on the other side of the house. So I don't have to see it. So,
but it feels so much better to go in the cold and then go take a shower.
Yes, it does.
And then, because then if I go in the cold plunge, because there's chlorine in there, I got to go back in the shower.
Yeah, but you got to do the hot first, heat the body up, and then shock it into cold.
So that's the way to do it, huh?
Yeah, it'll work. You'll get some benefit from doing it the way you are, but you won't get the maximum, the best benefit out of it, and it's still going to hurt just as bad.
I think I'm okay just getting some then.
Some or a lot.
Because it was either some, but there's three. There's some, a lot, or there's nothing.
Nothing.
So the some is better than the nothing.
Better than nothing. Yeah. In fact, I've had patients that to do this on a lower level. Have them right after, when they get through the shower, take a hot shower, let the hot water run on whatever part of the body is bothering them, dry off quickly, get out, and immediately put an ice pack on it for 20 minutes. So try to stay in the shower about 10 minutes, and then immediately put an ice pack on it, and had very good results with that too.
Oh, that makes sense. Yeah, because that's what I would do with my shoulder when I got out. That actually helped a lot.
Mm-hmm.
So, I mean, I guess I will start doing the hot shower than the cold plunge. It's so like, that's even more uncomfortable.
Yeah, I will probably know it living next door to you. I'll hear the screams in the morning.
Well, I just go in there for like one song, right? I just put my Spotify on and just like, you're in here for one song. And I haven't made it through like a whole song yet. I've got through like, I think I can do like a minute and a half.
Wuss.
Yeah. Well, Aurora tried to do that with me too, and she got like 20 seconds.
20 seconds.
So
usually kids can handle that better than adults can. They can handle the extremes, but yeah.
I mean, I just put my head down and like kind of like either listen to the song or just start counting, because it's just something that you want to get rid of. It's uncomfortable, but doing uncomfortable things is a good thing. Mm-hmm. Getting used to doing that,
Yes.
That's what I tried to tell Aurora. So
she didn't believe you, did she?
No, she did.
Oh.
Yeah, she actually kind of liked it. Yeah. She liked the shock, but that was a while ago. That was like before the summer, so we'll see how she does it now, because I think she was like 7, but now she's 8, so we'll see.
Oh, okay.
Yeah, big difference.
Yeah.
So you brought some visuals here, so can you walk us through what went wrong?
Okay, well, first of all, let me kind of tell you how the shoulder works. It's a 3-bone configuration. You got the scapula, the humerus, which is your arm, and then you've got the clavicle, the collarbone. So you got the shoulder blade, collarbone, and arm, and those have to work in conjunction. What the shoulder blade does not only provides a socket for the shoulder itself, shoulder socket, it provides mobility and stability. So when you lift your arm up, your shoulder blade swings out, and you know your collarbone, which is shaped like an S. The reason it's shaped like an S is because when you lift your arm and the shoulder blade swings out, the collarbone moves out of the way so you can lift your arm up all the way. Mm-hmm. If your shoulder blade is locked and does not move, and we'll get into that in just a minute, how that happens, then you can't move the collarbone out of the way to lift the shoulder. Well, you can still lift your arm up. Maybe not all the way, but you still lift it quite a ways. The way that happens is your shoulder translates forward just slightly. Now it's slightly out of socket. And when that happens, the muscles that you normally use to move the shoulder don't engage like they're supposed to, so your rotator cuff starts engaging. And rotator cuff's not designed to move your shoulder, it's just designed to rotate it. So you start ending up with things like rotator cuff tears, which are pretty bad, take a long time to heal, and are very preventable. We do a lot of work with the Veterans Association, the VA, and almost to a patient, they have shoulder issues.
Oh, really?
Yeah, depending on what part of the service they were in. The worst ones, of course, the paratroopers.
Oh, really?
Yeah, the guys are crazy enough to, what's the Air Force say? That they jump out of a perfectly good plane?
Why is that? Just because when the chute engages, it yanks up?
Well, you've got that, but hitting the ground is the same as jumping off your roof. That's how much force is in hitting the ground. Now you're trained in how to hit and roll and that kind of thing, but still, you hit uneven terrain. There's things that you don't see. You might get a tree between you and the ground, that kind of stuff. But a lot of the guys do that because it pays more. They go, $50, $70 a month more. Shoot, that practically doubles my salary right there. So I'm going to go airborne. Oh. So that airborne's the worst. Then the next one is infantry. Then after that's Navy. And then you have Marines and Air Force. Marines, for some reason, you don't see that many of them. And their injuries aren't as bad as the infantry.
They don't complain.
Well, I think it's also training.
Oh, really?
I think they're just better trained in how to handle these things, how to handle the situations, how to protect themselves. Of course, the ones you never see are special forces because it's only pain. And, I practiced with a Navy SEAL. My cousin's a Navy SEAL, and we have a Navy SEAL just 2 houses down from us. And all 3 of those guys are racked up, everything is degenerated, not working right. And I'm fine.
Really?
Yeah. They just, special forces, just like their mentality is, I'm just going to sacrifice my body and I'll live with the rest of it. Until you get to be our neighbor's age and you're looking at a double knee replacement and a, elbow replacement and, ankle and everything else going on. So,
buddy's good as new after that. Yeah. I mean,
almost.
All these aftermarket parts. Is he going to be smog legal after all that?
Probably. So, getting back to the shoulder, that's how the shoulder works. If the shoulder blade doesn't move out, this collarbone doesn't move out of the way, and then you end up with the shoulder not working correctly because it's not seating correctly in the socket. Mm-hmm. The shoulder socket's also very flat. It's actually, the socket itself has very little curvature to it. You have a little ring in there called a labrum, and that's actually what the shoulder sits in. And it's not very big either. But when you have increased mobility, you also decrease stability. So the shoulder's not very stable, but you got a lot of motion with it. So patient comes in with that, but that's just the end result. How does the shoulder blade get locked down on the back, the thorax. Most of the time, it's because the mid-back locks up. Now, remember I said when you have a malfunctioning vertebrae, or actually a malfunctioning joint, but we're talking vertebrae right now. With a malfunctioning vertebrae, you're always going to pinch a nerve, you're always going to create muscle spasms. Now, the muscles that attach to the back, some of those, such as the rhomboid, the trapezius, the latissimus dorsi, those all attach to the shoulder blade. So if those go into spasm, meaning they lock up and don't move the shoulder blade. Then you get muscles underneath the shoulder blade trying to help the muscles that are in spasm, and they go into spasm. So you get things like your serratus anterior and your subscapularis, which are underneath the shoulder blade. They spasm up, and they keep the shoulder blade from moving even more. Now, about half the time you adjust the mid-back, the shoulder blade frees up, and everything moves right. But you got to put the shoulder back into place. It doesn't go back in by itself. So I put that back in. The other half the time, you have to work on the shoulder blade. A lot of times you have to bring in acupuncture and massage therapy to break up the scar tissue in there for long term. And by the way, once muscles go into spasm and they've been in spasm for too long, rather than try to hold that contraction, the muscles start to create scar tissue. So instead of holding the contraction, they create scar tissue, and then you just kind of hang on the scar tissue.
So when you say it's a spasm, it's just tightened the whole time, right?
Tightened, yeah.
Yeah. So because when I think of a spasm, I think of like almost like a tweak.
That's a tick.
Oh, okay. Okay.
A spasm is it's contracting, and it's contracting constantly.
Right. Yeah. Because that's what it almost felt like, is like that I couldn't relax the middle of my back. You know, it was like
And you're never going to relax that until we fix what was causing your mid-back to have problems, which was essentially your low back. Now, once we got working on your low back, everything else started clearing up. But a lot of times you don't know where the problem's coming from until you treat the patient a few times and see what works and what doesn't work. Such as we treated your shoulder and mid-back, and a couple of days later, came right back. Right. It only lasted maybe a few hours. Okay, that's not long enough. Because once we realign the vertebrae, the ligaments which hold the vertebrae in place, they're still lax, they're still torn, they're still stretched, and they won't hold those vertebrae in place. They don't know as we put the vertebrae in place, the ligaments which hold them there don't just shrink right back down and hold it there. That is a long process, usually involving weeks or months.
Right. Yeah. It took like a couple months for
took a couple
for
months.
Me, yeah.
Mm-hmm. Yeah. There's when you have musculoskeletal problems, there's no quick fix.
Right.
There are miracles, but there's no quick fix. It doesn't go away quickly.
Well, then, after you fixed me, I thought I was like, oh wow, I'm good. I don't have to come back. But then, so I have to tell this story to the viewers. But so my dog, he's very good, and he's usually pretty well behaved. And so he was sitting right outside the garage, and the door was open, and because I was backing my wife's car out so we could clear the driveway for something. I forget what it was, but so I'm backing my wife's car out, and Sanford is just sitting there. He's just sitting there because we're in the car, and he knows he doesn't want to get run over. Mm-hmm. So he's sitting there, and then this lady walking her dog, she must have like dropped the leash or something. The little Pomeranian dog runs across the street to Sanford, and Sanford like looks, and he's just sitting there like, oh, this dog wants to play. The dog bites him. And then, so they're chasing each other around, and like I get out of the car, I'm like, oh shit, So all I have is my keys, and I throw the keys at the little dog to try and get him to stop, and I miss the dog. So I end up like grab the dog and like toss him that way, but now where are my keys? Yeah. And now my shoulder hurts again. And so I helped Steve remove all of his bushes so we were going to look for this.
All the stuff I was wanted to pulling out for the past 2 years.
Yeah.
They helped me pull out.
They would have had to pay the gardener for it. Yeah. But we ended up getting all that out in about, like an hour. That was pretty quick.
Or less, yeah. It was it was pretty fast.
And then my daughter goes over to the front door, and she says, hey, Dad, are these your keys? So she found them there, and I didn't have to pull them all out anyway, but it was okay. It was good to help neighbors out.
Yeah. Yeah, well, thank you. I tried to give your daughter $5 so I could throw the keys in the part that wasn't pulled out so we could get that done too, but she wasn't going for it. So,
well, we finished the job, though.
Finished the job.
And then I had to come back.
Yeah.
And that only actually took one visit.
Then I took one visit. There's several things. First of all, you're relatively young. You're what, 24?
And a half.
And a half, yeah. That's the big half. And in pretty good physical condition. So that always helps too. But you do have permanent instabilities in the low back that are eventually going to work their way out, that eventually the mid-back's going to work its way out to compensate, and then it's going to start tightening up and it's going to affect the shoulder again. You may have to come back, once a week, maybe once a year.
Mm-hmm.
And you don't know until you just start, okay, how long can you go before it starts to bother you? And then we'll see.
Mm. Well, I mean, I guess I just need to stop sitting on my ass and not doing anything, because that's really what triggered that. So, I mean, as long as I keep relatively active and relatively healthy, not like get overweight or whatever, then probably like once a year, right?
Yeah, it does. Yeah, it's whatever however unstable the vertebrae are, and then your physical activity. Physical activity, going to the gym always helps. Mm-hmm. People who work out regularly always heal much more quickly, need a lot less care, need a lot less follow-up care. So it works real well. Like I had a patient that if he didn't run a mile a day, his back would kill him. If he got out and ran a mile a day, his back was fine the whole day.
Well, that's kind of like it's kind of like the movie Speed, where like if you slow down, you're gonna blow up.
Yeah. Yeah, that's a good analogy. Yeah, you do, one way or another.
So you brought some pictures in here. Mm-hmm. So this right here, this was on me where this blue area was where it had come off, right?
Now that was looking at the shoulder blade and the arm from the front.
From the front, okay.
And then you have, the blue, the large blue area, that is your shoulder capsule. That was the part that was out of place. That was not functioning correctly.
Okay. So was the humerus was out? Yes. The humerus is just the shoulder bone.
Yeah, the head of the humerus was not sitting correctly in the socket of the shoulder blade.
Okay.
Or the fossa.
Let's see here. So then in this one here, posterior shoulder, this is from the back then?
From the back, yes. And now you have several muscles in the back. You see that ridge that kind of goes to the top 1/4 of the shoulder blade? You have a muscle above that. Now, by the way, that's called the spine of the scapula. The muscle above that is called the supraspinatus. Clever name. Yeah. And the one below, it's the infraspinatus. Easily remembered. Those are two of the rotator cuff muscles. And the one that almost invariably gives is the top one, the supraspinatus. It's about as big as your little finger. So it's just kind of the smallest of the group, smallest of the four muscles. And that goes across the top of that ridge and attaches to the top of the humerus. When that one tears, then you end up with a pain where you can't take your arm and what's called abduct it, meaning taking it away from the body. Start taking it away from the body out to the side, and you get this ugly pain that feels like somebody just hit you in the arm with a baseball bat.
Oh.
The arm just collapses. You can't do anything.
Huh.
Most of the time when people come in, that pain doesn't kick in until they get about 90 degrees. I have had patients that have come in, they couldn't even move their arm away from their body. Of course, then we had to really dig into it to see if it was a surgical problem or not.
Right.
Because when you have rotator cuff tears, they have to be dealt with, depending on what muscle is torn, but they have to be dealt with fairly quickly because the muscle will shrink, and there's no way the surgeon can pull that muscle, stretch it back out to where you can bring the end that tore to the end where it attached. So, you end up with a permanent tear, which is not much fun either.
Yeah, so you would be like the first line of defense for this.
Yeah.
Like you wouldn't go to an acupuncturist first or whatever, right?
Well, like in the VA. VA has chiropractors typically in their emergency room, and somebody comes in musculoskeletal, they do the evaluating. They say, okay, Is it a chiropractic problem? No. Is it a PT problem? Yeah. Okay, send it to PT. Or is it an orthopedist problem? Send it to the orthopedist. And so they're the first line of triage. And that's kind of the way, people tend to use chiropractors as a last resort. Nothing else works. They've been to their physician. They don't want surgery. All they are is on drugs. They've been to massage therapy, which works very well, but it has to work in conjunction. Been to massage therapy. It works, but it doesn't work that well because they've got underlying problems that won't allow it to work well. And I'm a big fan of massage therapy. They may have been to acupuncturists, and acupuncture has worked to a point, but they're still having problems, lots of problems. So they come to us as last resort. If they came to us first, we could have said, okay, this is what you've got. We're going to do this, this, and this. Then you need to go to see your massage therapist to keep the muscles loosened up. And when we're done with this, for the residual discomfort or muscle strains you have, then we send you to an acupuncturist, which we use all those, well, actually all three of them, acupuncture, massage therapy, physical therapy, and orthopedic surgeons. We use all of those because people come in with all kinds of different injuries on that spectrum.
Yeah, I mean, I wish I kind of would have known about that when I got in, because I got into this accident where some guy rear-ended me on the freeway, right? Where I was stopped in I had a Silverado at the time. Mm-hmm. I was stopped in it, and he was hauling ass in this Toyota Yaris. Mm-hmm. And he's lucky to be alive.
Yeah, really.
So he nails me going like 60. He didn't even hit the brakes. Oh, because he didn't see, right? Because there was this part by SFO. It was in San Mateo by, or maybe it was. Yeah, it was. I think it was in Burlingame, but and where it's around a corner, and the corner had just stopped, and it was like everybody was coming out, like the kind where you almost need flashers, you know. But I didn't have time to hit the flashers because I'm looking in my rearview mirror because I'm stopped, right? So I'm like, oh shit, this guy's not going to stop. So I try to turn my truck to go into the shoulder. Mm-hmm. So I turned it enough to where when he hit me, I didn't hit the car in front of me, but I did hit that center divide and went up in the air on it, right? And the truck was totaled because when it came down, it cracked all the wheels. Oh. Yeah. So, but then, obviously nothing, I wasn't in any real pain that day because of adrenaline and whatever, but like going a couple weeks out, couple days out, everything like that, it started to really hurt, like my neck and everything. So I went to the doctor, and like, if you look like you're in pretty good health and you're relatively young, they always think that you're asking for pills. Mm-hmm. And so like, I was like, I don't want any pills, but I do want to I want this to go away. Mm-hmm. You know what I mean? And so all they would recommend for me was physical therapy. Mm-hmm. Because they're kind of trained to only recommend what is covered by your insurance, because the acupuncture wasn't covered. Mm-hmm. They didn't even mention chiropractic. Mm-hmm. I think surgery was too far down the line. I wasn't that far, so I didn't need it. But then like the only thing that they could recommend is here, physical therapy, and then also take some pills, and it's just like, it didn't work. It was also like, here, let me give you some homework to do at home. It's like, it doesn't work like that.
No.
It's hard to do.
Patient compliance with exercise is really, really low.
Yeah.
I mean, there are instances where we are supposed to give exercises and stretches too. Like the VA wants those for all their musculoskeletal problems. I give them to the patients and I say, here, go ahead and do these. And they come in the next time. How did the exercises go? I haven't started them yet.
Yeah.
2 months later, how are the exercises doing? I got to get back into them. And they'll do them once or twice, and it's either it's inconvenient, even though it only takes 3 or 4 minutes, or they felt better, so they stopped it. And now they're feeling worse again, but they haven't gotten back into it. Mm-hmm. Yeah. So patient compliance on exercises is really, really low.
Yeah, I mean, I did end up going to acupuncture and just like paying out of pocket and telling insurance to, pay it afterwards or whatever. And that helped with the pain. Mm-hmm. And it was my first time doing acupuncture because I'd done like massages and stuff. And that was, it's okay, but I don't like to get all oily. I hate that feeling. I hate it. So
there's some great jokes in there, but I'm going to let them go.
Well, Some Diddy jokes?
Yeah.
We've heard them all, Steve.
Oh, okay. Well, never mind. Nothing original to say.
But, you know, like the acupuncture, when they do, like they cup and they light the candles and they, you know, afterwards it looks like you got in a fight with an octopus.
Yeah.
Or a kraken.
Yeah.
You know, and that actually, it felt really good. I felt great after that. But it didn't last for forever.
Well, the thing is, acupuncture works on a lot of stuff. I use it mainly for pain management with my patients. And there's a number of times when I get the patients to a certain point, they're as stable as I can get them, but they still have residual pain. And that's because of muscle memory. And acupuncture works very well in breaking that up. So, you know, I have acupuncturists. We refer back and forth all the time. Now, patients not getting well on acupuncture, they send them to me. I line the spine back up to go back to acupuncture. They're getting well. Same with me. I'm working on the patient, get them to a certain point. Now you need to have acupuncture to clear out the rest of this pain. They go over there.
So like there's acupuncture, there's chiropractor, physical therapy, and orthopedic surgeon. So it's all kind of like the Justice League of pain.
Yeah, I always thought that the perfect clinic would be if you had a massage therapist, you had a chiropractor, physical therapist, and an orthopedic surgeon. Because you could take care of all the musculoskeletal problems within those 4 groups.
Yeah.
And in that one clinic. You wouldn't have to go out to any place else. You know, you could go to physical therapy. Now they need to be realigned. Okay, back to physical therapy. But they actually need massage therapy to go to them. And then, you know, or if they get to the point, no, this is not getting better, you got to go see the surgeon.
I think, so it would be kind of interesting, right? Because acupuncture or massage therapy, it's usually really quiet. Mm-hmm. And it's like dark and there's like maybe candles and, you know, something like that. But then in chiropractor, it's like, oh, you know, hey.
It's all open treatment. Yep. Yeah. Like physical therapy, y'all in one big room with a bunch of tables.
Yeah, it's just somebody like, oh, yeah, you know, because you can't help but make those noises sometimes.
That feels good.
And it's so it's so satisfying. And you must know because you hear these cracks. It's like, wow, got him there. Mm-hmm. And I always used to think like.
By the way, just because it pops doesn't mean the right one went back into place. That's why, as you noticed, whenever I treated you, I adjusted you, then had you sit back up and reevaluated everything else to make sure everything moved. Mm-hmm. And occasionally found, this one didn't release, so we got to go back in and release that one. So if you don't double check, you don't know, just because it pops, you don't know if it actually released the vertebrae and then it's reseated itself naturally.
Right. And I remember when the first time you popped my shoulder back in and it was able to go back in, like that was probably the biggest difference of any of the visits. And then ever since then, like when it would come out, like I think for the next like month or so after I had to go, I was able to like do that myself, you know? Yeah,
you're going to get the most pops, the most reaction the first 2 or 3 times. And the best way to illustrate that is, if I can use this camera right here, if you've got a socket and a joint, and this is their normal space between them, when you come in and see me, they're jammed together and they're malfunctioning. Now, when you adjust that and you pull it out, that's the pop, and then it reseats itself naturally. Well, the next time you come in, it's not all the way. It's only this far. So you only get less of a pop. Then it's less and less and less, till eventually you come in, it's out just a little bit, we put it back in. Patients that I've been seeing for several years, they don't even usually pop when I adjust them. They can feel the vertebrae move, I can feel them move, but there's no pop because the vertebrae aren't out that far. It still creates problems. It still pinches the nerve, still creates muscle spasm. But that's why you're going to get the most relief and the most noise the first 4 or 5 visits.
Well, how do you know then it's adjusted in? Do you just feel it after you've tried to adjust it if there's no pops?
Yeah, well, you go back and repalpate. Because you evaluate the patient when they come in, see what vertebrae are locked up, which one aren't, where's the muscle spasms, where's the tenderness. You adjust them, then you go back and do that all over again. And you should see a difference. If you're adjusted the neck and everything sounded like it went okay, but you go back and look, you still got one out right here. This one didn't move, so you have to go back and adjust that one.
Okay.
Which, by the way, people that adjust their own backs, usually low back's not bad because most people adjust their low back. They just bend forward a lot and stretch everything out.
Mm-hmm.
But self-adjusting, I've had patients ask me, hey, can you show me how to do that on myself? And I tell them, well, if you figure that out, tell me, because I can't adjust myself.
Oh, really?
No, I mean, there's no way I can, I can get in there and adjust my neck the right way. Even the neck, which would be the one you would think you'd do the most, you grab onto it and just give it a twist. That does not take care or does not relieve the one that is actually causing the problem, the vertebrae that's causing the problem. People who self-adjust, especially their neck, usually do it several times a day. If they got to the vertebrae or reset the vertebrae that was creating all the problems, they do it once every week or two, like they would if they're going to the chiropractor. What you do when you self-adjust your neck, you're kind of moving a rock around in your shoe, changing the neurology temporarily, because you're moving the vertebrae above and below the vertebrae that's malfunctioning and creating all the problems. So I tell patients, if you're going to self-adjust, just go within a normal range of motion and like this. If it gives, fine. If it doesn't, don't force it. Because when you force it like that, you end up stretching the ligaments more than they already are, and you just make yourself more and more unstable.
Oh.
Physically, not mentally.
Oh, okay. Thank you for clarifying. Because I always it always would scare me when people would adjust their necks or whatever. Because I watched Steven Seagal movies. We all have, and that's how he gets people.
If I told you how that works?
No, how does that work?
Okay, first of all, breaking somebody's neck is difficult to do. You would first of all have to catch them off guard, and you have to be really big and they have to be really small. There's a reason you drop 7 or 8 feet when you're hung to snap your neck, because there's a lot of force involved. The Steven Seagal movies, he doesn't break their neck. There's almost no way he could. He could dislocate it, put them in a world of hurt. But when you go up behind somebody and do that fast, it's the same as getting hit in the jaw. The neurology at the base of the spine, base of the brain, says, something's really messed up. You're on the ground. So it doesn't know what's happening, just know that something is really, really wrong. So basically you pass out and you're on the ground. So that's what, when it comes up and does that to somebody, that's really what happens. People think he breaks their neck. No, that's not it. He just knocks them out from behind.
Oh, shit. Because maybe I told you about this, but I was in Mexico, in Tijuana, and I was in the back of a cop car, and I was
what a surprise.
Indeed. Well, there was 2 other people in the back of the cop car with me, but they ended up being in on the scheme, so they got let go. And so these cops are taking me, and I'm thinking, because there's no grate separating the backseat from the front, and I'm not cuffed. So I'm psyching myself up to just go in the driver, And this cop was not in the best of shape, so I probably could have got it. And then the passenger cop would have either had to get me or drive the car. Ended up not having to do that, but long story short.
Yeah.
But so it would not have killed that officer. No. Then
it wouldn't have killed him. The very least, you would put him in enough hurt that he probably couldn't drive the car. His neck would hurt so bad just from the strain of the muscles and the instant pain, and probably the shock. He wouldn't be able to drive the car.
Okay.
I don't know if I want to be in the back seat of a car that somebody's not driving.
It's better than going to jail.
Yeah, well, I guess so.
Take the chance.
Take the chance.
Yeah.
You take your chances. Yeah. Now that's showing the muscles of the rotator cuff, which the very top supraspinatus we talked about, infraspinatus we talked about. Then you have teres minor, and you also have teres major, but that's not shown there because it's not part of the rotator cuff. Then you have this subscapularis. That's the one in the back that locks down, and that ridge. If you look at the one on the left, where it says it's pointing to the scapula, that is called the medial border. That runs all the way to the top. You have other muscles, such as the serratus anterior that attaches to that actually holds your shoulder blade down, holds the end of the shoulder blade down so it doesn't wing out. And those muscles are designed to rotate the arm and nothing else. When patients come in and there is tenderness in the infraspinatus or in the rhomboid, in the teres minor, then they're setting themselves up for a rotator cuff tear. Because those muscles are already strained, and it's not going to be too long before that top muscle, supraspinatus, is going to give, and it's going to tear, and then you're going to end up with a whole lot of problems.
So for mine, it was the clavicle was uneven, right? With the collarbone.
Now the collarbone, you actually have three joints. You have where the shoulder sits into your arm, sits into the socket, the glenoid fossa. You have the acromioclavicular joint. That's where the collarbone attaches to the clavicle. Then you have the sternoclavicular joint where the clavicle attaches to your breastbone. And when the collarbone does not work correctly, it can either malfunction at where it is with the shoulder itself or clear over at the sternum. And if you put everything back into place, but don't put that back into place, it's going to start knocking everything back out again because it's not functioning correctly.
Makes sense.
You can't fix 3 out of the 4.
Yeah.
You got to 2 out of 3. You got to fix all of them.
Well, I mean, I'm very thankful that you were able to fix it.
Yeah.
And
so's your wife.
Yeah.
Get to listen to you anymore.
The moaning.
Yeah.
Yeah. So you also switching gears a little bit. You recently got back from Disneyland.
Yes.
And they had changed some things up.
Well, they've been changing them up ever since COVID. And it was, this time was significantly different than the other times we've been there. That we've been going to Disneyland on a regular basis for 30 years. Anywhere from once a year to as many as 4 times a year. And since COVID, they had a chance to really kind of change things up, such as with their annual passes, which I'm assuming most people know what they are. You buy a pass to last all year. Before COVID, an annual pass holder could go anytime they wanted. It wasn't unusual to have talk to the person next to you. They were an annual pass holder. They came in just to watch the fireworks, and then they left again. That's all they wanted to do. Or came in to ride a couple of rides and leave. But problem is that on weekends, when most of the people who are available to buy tickets, usually Disneyland was crowded with annual pass holders, which, you prepay, and they don't spend nearly as much money as the people who buy a day pass. So when they did, after COVID, they had started what's called Magic Keys. And those have blackout dates. And you have to make reservations, and so many annual pass holders are allowed in the park on a specific date. So sometimes if you're lucky, you can find one that's only a couple days away. Most of the time it's 2 or 3 weeks out, depending on what you want. If you want a weekend, you may have to spend, go 3 weeks out. You just can't hop in the car and go and show your pass and get in. And with that, everything's gone digital and gone onto your phone. It used to be if you wanted a fast pass, which got you to the head of the line, you went to a kiosk, put your ticket in, it gave you another ticket that said come back between 4 and 5, and you came back between 4 and 5, gave them the ticket, and you got to go to the head of the line. Now, you do all that on your phone. And I don't spend a lot of time on my phone, but I think I spend enough to know my way around it fairly well. And I was lost, and I read up on all this stuff.
So you're talking, was that the Fast Pass or the Genie Pass?
Well, they don't have Genie Pass anymore. They have what's called Lightning Lane. And you can buy a Lightning Lane. I think it's $31 for a day, which my experience is you can buy it anytime you're in the park. So you can buy it when you first get there, or you can buy it later on. I usually like to find out what the lines are like. If it's 35 minutes or less, let's just wait in line. Because, a lot of things are pretty well themed, so it's it's not like you're just standing in a line to switch back and forth for 35 minutes. You've got things to see, things to do. On I was having a hard time figuring out how to make reservations on the Lightning Lane, how to make reservations for food, which I'll get into that in a minute. And finally, Renee, my wife, said, why don't you go to City Hall and ask them how this thing works? Well, I go up to City Hall and they go, oh, see these little 3 bars over here? You press that and that's your menu. And I thought, why don't you have menu written there instead of putting it in code? So if you press that and everything came up. I go, okay, that's easy. Once I found it, then from there, if you have Lightning Lane, you can make your reservations. And reservations in Lightning Lane, you make a reservation for whatever time is available. It may be 4 hours away, but every 2 hours you can make another reservation. Or 2 hours, or if you use that Lightning Lane, say you make a Lightning Lane for 10 o'clock, you're there at 9, make a Lightning Lane for 10. Well, once you go to that 10 o'clock Lightning Lane, you can then make another reservation. It's either 2 hours or when you go to the ride itself. That's just the start of it.
It's like, because last time I went, you were able to like go and run and get in the lanes and it's so much planning.
It's a lot of planning, and everything's done on your phone. If you don't have a phone, you can't use Lightning Lane. You can't make reservations for dining, anything like that without a phone. You have to wait in line. So if you use Lightning Lane, everything's on your phone. You got to pull it up and they scan it to make sure you got the right thing. The other thing is the dining. Now, dining, you can make reservations to pick up your food. So you go on the app, look at the menu, decide what you want to eat, pay for it, and they tell you when you can pick it up. So what happens is, in that time slot, usually it's about 45 minutes to an hour, anytime in that time slot, you go to that restaurant, you click I'm here, and as soon as you do that, they start making the food for you. So it's like you at the head of the line. And then when it's ready, they text you, which is usually, most of it's fast food. You go up and you just pick it up at the designated spot. And I got to say, the food at Disneyland has gotten significantly better.
Really?
It was really good. It was the, not the dry hot dog with the fluffy bun that's been sitting in the steamer for an hour. It was all really, really good. And for a theme park and everything they gave you, I didn't think it was really that outrageous. Because Disneyland is not inexpensive, but I didn't think it was that bad. It was, the only thing that irked me is you had to make a reservation to get an ice cream cone. Why can't you just wait in line?
Well, do those like the Lightning Lane and the Fast Passes, those cost extra per person per ticket, right?
Yes.
Or per person per ride?
Per person, yeah. Now, you pay, I think it's gone up to $31, which is not bad. An extra $31 per person.
Per ride.
That you got, yeah. Well, no, that's for the whole day.
Oh, really?
Yeah, you can make a reservation every 2 hours. So if you get there at 8, you can, and you stay there till midnight, which is, the 16 hours, you can make eight Lightning Lane reservations.
So what I was thinking of then must have been Fast Pass, because that's what it was when it was $15 per person per ride, right?
No. There's two types of, well, first of all, the Lightning Lanes. Mm-hmm. There's two kinds. One you pay the $31 for and you get every 2 hours. Then there are two rides. One is the Rise of the Resistance in Star Wars Land. And the other one is Radiator Springs Racers in California Adventure. And those if you want a Lightning Lane, you have to buy that.
Oh, just for those two rides because they're so popular? Yeah,
and it's dynamic pricing, anywhere from $19 to $30. Typically, we pay about $25. And especially Rise of the Resistance, it's just a great ride. It's a 20-minute ride. I mean, it's long and it's involved. It's worth $25 a person. And I would do it multiple times a day, but you can only do it once a day. Oh, really? You can only get a fast pass. You only buy a fast pass once. Yeah. After that, you got to wait in line. And if you can get a line for Rise of Resistance or Radiator Springs that's anything less than an hour, take it.
Oh, because we're thinking about taking the kids, but it's like there's a lot of planning involved to make it so that it's not like we're waiting in line with a toddler for 2 hours or something. You know?
Mm-hmm. Exactly. With kids, it's a whole different dynamic because I can't tell you how many times people have taken their kids to Disneyland and the kids like the pool at the hotel better than they like anything in Disneyland because they don't have to wait in line to do anything.
Yeah.
They don't have to walk anywhere. They're right there.
Right.
Okay.
Did you guys get to go to Club 33?
Yes, we've been to Club 33.
Why don't you mention that a little bit? What's it like?
Very, very nice. It's 4 or 5 stars, probably 5 stars. It's really pricey, but of course it's an experience. That's what it is. I was there before they changed Club 33 and then after they changed it. When I was there before they changed it, typically it was about $4,000 to join and about $4,500 a year, which I thought, well, that's not bad. I mean, that's affordable for a good part of the population. It's not cheap, but it's not like crazy expensive. So we had a friend who had a membership to Club 33. And, oh, by the way, then and now, what you have to do is you have to mail a letter of intent, and then they put you on a list. They don't release how many people they allow in, how many people have memberships, anything like that. 20 years ago when I was looking into it, it was about a 3-year wait.
Oh, wow.
And but once you got in and paid your dues, you were there for life. And the dues just got you in the door, and then you had to pay for the dinner.
Right.
But and then it was about $150 a person with a glass of wine and tip, which for a really good meal, and you spent a couple of hours at least, and it was really kind of nice because everybody around there, you had some people that were regulars, but a lot of times it was guests and people like me just excited to be there, you know. Mm-hmm. And the waiters taking pictures all over the place.
This is not something where there's any kids in then.
I never saw any children in there.
Yeah.
I know they do let them in, but they're pretty strict about that.
They have to be deloused before they come in.
Yeah, gagged, tied up. So now that that was quite a bit of fun. Had done dinner and lunch there. Then they redid the whole thing, and they slowly started canceling all of the Club 33 memberships, starting because 3 levels. It was gold, silver, and bronze. First with the bronze, and then the silver, and then the gold. They started taking away your perks, like you didn't have valet parking anymore. You could only bring one person into Disneyland at a time instead of used to be 4. And to make reservations was a lot tougher. You were limited on the reservations you could make. So I was there afterwards. So instead of the 4,000, 4,500 to join, and then the 4,000 a year, it is. I've heard varying accounts, but the one that keeps popping up is 25,000 to join and 15,000 a year.
Whoa, that's a big jump.
That's a huge jump. So, like the friend of mine who had his membership, he said all you saw were people who were in their corporate guests.
Yeah.
Or rich old men and their hot little girlfriends, hot young girlfriends, okay, trying to impress. But after they made the change, most of the time when I went in there, I went in with a friend of ours, we went into the lounge, which had all the food that you had in Club 33 without the people and a whole lot more entertainment. Because like the pictures changed, and then they had, when they would have them playing jazz, pictures would light up all over the room with different instruments and different, being played, different parts of it.
Oh, nice.
But it was a great experience. We could have done it every time we went there. We did it about once every year, once every 2 years, because it did take about 4 or 5 hours out of the park. Oh, and that's what we went for.
Right. You didn't go there for like some 5-star dinner or whatever.
Yeah, that's not why we went. We went for the experience, and it was a great experience.
But is that just it, or is there because there's another level then, right? With the Club 33.
What do you mean by that?
Like there's there's the isn't there regular Club 33 and then there's like something that's on top of it?
Not that I know of.
Oh, so there's nothing where you can like eat breakfast with the cryogenically frozen head of Walt Disney?
No.
Okay.
Well, there probably is somewhere, but not in Disneyland, no.
Yeah, because I mean, we just, it's still a lot of planning, and we may just say we're just going to go to Universal instead because Ruby's still young, and so she won't really remember it.
No, and the problem with Ruby's age is that, you know, the characters can be kind of scary to them because they don't look, they're you know, anamorphic. They're not real people. They're oversized, and I've seen more than a few times the young children not wanting to get close to them.
Yeah.
You know, once you get to be like 5, 6 years old, oh, there's Mickey, there's Goofy, that's great. Mm-hmm. Then they'll wait in line for an hour to do that.
Right.
But not the young ones. And one thing I see a lot of at Disneyland is strollers.
Ugh.
And I could not imagine taking a 1-year-old, 2-year-old. And I've seen some that are just, you know, they're weeks old.
Oh yeah.
And I said, what are you thinking?
It seems like such a waste.
Yeah, I mean, mom can't go on a ride unless dad or auntie's holding them. Mm-hmm. Okay, the kids can't go on a ride by themselves because they have to have somebody who's, you know, like over 14 or, you know, hit the minimum height size.
Right.
So,
well, we because we're going down to like the Southern California for Thanksgiving, so we were gonna like stop maybe on the way or something, but we may. What I'm thinking of doing, because there's this Chuck E. Cheese in Northridge, and it's the last Chuck E. Cheese that has the animatronic band.
oh, really?
So I might take them there before so that they can see like, now this shit's really scary, huh? Suddenly Mickey isn't so bad. You know?
Well, you know, with a child the age of Ruby, you might be better off going to Universal Studios.
Yeah.
First of all, it's in one day you can do everything.
Right.
It's not like Disneyland where you can go back. You can do everything in one day, or you can spend a day there, or you can spend 5 days there and see every day see something different. Universal is smaller, not as well developed, but it's still entertaining. Mm-hmm. And I have a lot of patients who are Disney fans, and they'll go to Disneyland 4 days and 1 day to Universal.
Yeah.
And but they said that's it. 1 day at Universal, that's all you need.
Or Knott's Berry Farm. Mm-hmm. They're talking about like getting rid of it.
Oh, really?
Yeah.
Well, I
think they have for a while.
The big difference between Knott's Berry Farm and Disneyland, and this used to be Universal, but they have finally learned why Disney is so popular. Disneyland was created. I mean, the creative process. Disney said, "This is what I want." Then he sent his creators to do it. It was done by mostly background artists. So it wasn't done by the people who drew the characters. It was done by the people who drew the background. So instead of being on the outside looking in, like you are at Knott's Berry Farm, you're looking at dioramas. Mm-hmm. You are in the diorama. And that's the difference at Disneyland. You are in there looking out. It's not you're outside looking in. So you feel more immersed, more like you're in somewhere than just kind of walking through a museum and seeing different displays.
That makes sense.
Mm-hmm. Universal finally figured that out. And that changed everything at Universal.
What did they do to switch it up?
I am pretty sure they hired a bunch of former Disney Imagineers. And finally listened to them.
The old bait and switch.
Yeah, well, every theme park always said, well, Disney did this, but we can do it better. Mm-hmm. So you take the best and the one that works the best, and you try to make it better. Well, they didn't. Nobody did. Because they fell back to the old diorama. Look outside, looking in at a scene rather than being in the scene yourself.
Right.
Well, it's like if you're in the dark rides, when you're in the dark rides like Pinocchio or Mr. Toad ride, you're Mr. Toad. You're riding in the car and you're experiencing everything he did, or you're Pinocchio and experiencing the thing he did. Same with Snow White. You are Snow White, and what you're seeing is what she sees. So you're in the scene. Mm-hmm.
Yeah, I mean, well, and if you think about it, like the shows at Universal, right? Like they have like the Indiana Jones thing, and then they have the Water World. It's kind of like a show, right? I don't know if they still have it or not, but
I've been to Universal since I was in chiropractic school, and that was before you were born.
So the Water World was definitely not around then.
No, and it was, and it used to be. You just went through a bunch of scenes. You went through European town square, the New York brownstones, the different Galactica. You got to see a bunch of props, and you're on a tram. And, it was a tour, is what it was.
Well, we had this walking tour because I went with my dad, my grandma, and my sister, and it was like we were walking through the set of, I think it was Jingle All the Way, the movie with Arnold,
Oh.
And so we were, if you look in there, somewhere around there, we're extras in that parade scene. So like,
wow.
Yeah, I mean that was probably the coolest thing, And then it was right when I think we did like that kind of multiple thing, right? 'Cause, like we went to Disneyland for a couple days and Universal, and so we switched it around. One day we went to Disneyland. There was this woman who was like screening movies,
Mm-hmm.
and it was like the live action version of 101 Dalmatians.
Oh.
And so like because Disney was, I guess, just starting to roll out hey, we're gonna make everything live action now.
Mm-hmm.
And that was one of the first ones. So like we got to watch a little bit of it, and I was like, wow. It was like a cool little thing, and they asked us a bunch of questions, and you felt real important,
Oh yeah, they preview that for the what do they call it, when they ask everybody's opinion, and then they say, okay, we need to tweak this, or this is fine, or this isn't working. That kind of thing, yeah.
We were just eating lunch, and then they came over with like this little like an older style camcorder. Remember when they used to have like the whole screen as it, like that kind of thing. And so we were watching it on the screen. So it was a different kind of thing. I didn't expect it, but like I'll always remember that. But we're probably just going to go to Universal anyway.
I think that's probably your best bet. Otherwise, you're going to have to spend at least several hours reading all the information on how to use the app, how the different ways things work at Disneyland. You have to realize that Disneyland is different than all the other lands. Mm-hmm. Universal, Shanghai, Paris, Tokyo, in that most of the people that go there live within 2 hours. So most of the people that go there go on a regular basis. They go there 2 or 3 or 4 times a year. So they're used to using all this stuff on their phone. Once they get it learned, then they got it, then it just flows. If you only go once a year, or like us, it was all brand new, and I did a lot of reading and still had to ask for help. By the way, in Disneyland, they have 4 different areas where they have guest services, and all they do is show you how to use the app.
Oh, really?
Because when I went to town hall, they said, okay, this is how you do it. And by the way, here's where all the other areas are. So if you have a question, go ask them. And I had 2 more times I had to go and ask additional questions. But they go, okay, here's how you do it. Here's what you're doing. Oh, okay, now that's easy. But that's how confusing it can be.
Yeah, I mean, I imagine it's Universal's probably right behind Disney as far as getting there with some kind of complicated app.
I would think so. I mean, if Disney's doing it, and they're doing it in all their resorts, and it's working for them. And the great thing about it really works well for Disney because it helps them plot out where the crowds are going to be and how many people they need in any particular area at any particular time. So if you can't, with like meal reservations, they know they're going to have this many people going to walk up, but at this time we're really busy with the reservations. This time we're not. So we're going to put a bunch of people in here, then we got to let them go someplace else during this next 2 hours. Right. So it really helps them with staffing and getting people where they need to be to help the guests.
Right.
And it's a pain in the butt for the guests.
Yeah, no doubt. I'm not looking forward to that because you have to navigate that and navigate the toddler's temperament.
Yeah. So we never took our daughter there till she was about probably 8 years old.
Oh, really?
I think she was about that old first time we went. Might have been a little older. But anyway, and we allowed her to bring a friend. We just have one daughter, and she brought a friend. Mm-hmm. And then we did that every year. And then I think she was about 14, maybe 15. And about halfway through the day, she goes, Dad, can, Allie and I just go off on our own, do our own stuff? And we thought, well, it's Disneyland. They can't go anywhere. And they're safe. Yeah, sure. We'll meet you back, at the front gate, in 4 hours. 4 hours later, we said, get lost. We'll meet you back here at midnight. And don't bother us in between. Because we're going, well, this is great. We can go wherever we want, whenever we want. Don't have to haul the kids around. They're not complaining. You don't have to go to the bathroom. They're not hungry.
Yeah.
You know? And so from then on, every year after that, okay, you two, we'll meet you here, at dinner time. And, here's $20.
Yeah. God, I'm like, I don't know if I could do that. I mean, it's a different world now.
Mm-hmm. Well, Disneyland they have a phenomenal system. If you can't find your child or they suspect the child's in trouble, they lock down Disneyland. You can't leave.
Oh, really?
There's one famous story where a lady had her daughter, and also her daughter turned around, her daughter was gone. And she couldn't find her. And just, she can't wander off that far. She went to guest services and told them what happened. They locked down Disneyland. And what happened is he took the girl into the men's bathroom, put her in different clothes, and put a wig on her. Told her it was all a game with mom and dad, and then we're going to go meet mom and dad outside. So they got to the exit gate, and they said, just a minute. This is about the right age for the girl. Took the wig off, and she'd been abducted by a sex offender. So when something like that happens, they take that very, very seriously.
Oh, wow.
So, if you have any issues, with your kids not finding them, of course, they also have any kid that gets lost can go up to a cast member and say, I can't find my parents. And say, okay, stay here. And they'll take usually the children to what's called lost and found kids. And then they will try to find the parents. They'll get a description of the parents, try to find the parents. Or if you can't find your kid, the first thing you do is ask a cast member. They will call lost and found kids to see if your kids are there.
Oh, I did not know that. I did not know about that story either. That is a crazy story.
Yeah. And, they never had an incident where they couldn't find a lost child. So track record's pretty good.
Well, it changes everything, I guess.
Yeah. So it's just, okay, Aurora, here's $20. Take care of your sister. Mom and dad are out of here.
Probably be more like $100 today.
Yeah, probably more like that. Yeah. $20 it might get you an ice cream.
That you still have to, because she wouldn't have a phone, so she wouldn't be able to get anything.
You have to stand in line for everything. Yeah.
Yeah.
Yes, that's true. I thought about that. So you have to make sure that your child has a phone and they know how to use that.
I don't know about that.
Yeah,
we'll see.
Yeah, we'll see.
Yep. All right, Steve. Hey, thanks for coming by.
Well, thanks.
Very enlightening.
Yeah. Thanks for all the vodka in my water bottle. I appreciate that.
Hey, anytime.
Yeah. Again, it's 5 o'clock somewhere.
Just make sure you brush your teeth before you talk to your wife.
Oh, yeah. Can I borrow your garden hose?
All right. Well, thank you again, Steve, and we'll see you guys later.